I'm Dr. Bernstein. I'm a vascular surgeon at the Doctor's Clinic and at Harrison Medical Center. I'm going to talk to you today about maintaining good vascular health and what you need to know now about PAD, or peripheral artery disease. PAD refers to narrowing or blockages that develop in the circulatory system. These blockages can develop anywhere in the body that blood flows: the neck, the heart, the vital organs, or the legs. PAD is a leading cause of premature death and disability among seniors in the U.S. PAD affects more than 8 million people in the U.S. alone, especially those over age 50, or African Americans, or Hispanic Americans. It is also estimated that up to 1 in 20 Americans over age 50 has some PAD. It is also important to note that the complications of PAD can usually be prevented with early diagnosis and treatment. Most people are completely unaware that they have PAD, particularly in its early stages. The problem of PAD depends on where the blockage occurs. Because the blockages of PAD develop slowly, most people are actually unaware that they have a problem until complications develop. Stroke, heart attack, kidney failure, aortic aneurysm, and poor leg circulation are all complications of PAD that can be reduced with early diagnosis and treatment. Healthy arteries are smooth, elastic, and unobstructed. Blood should flow freely to nourish the tissues with oxygen, glucose, and other important nutrients. PAD results when the arteries become rigid, narrowed, or blocked with cholesterol fatty plaques. The tissues of the body then become starved for nutrition, and they don't perform normally. Our legs have arteries that supply the muscles, nerves, skin, and bone with enough blood to carry us for miles and miles without fatigue. As peripheral artery disease develops, though, you may notice cramps, fatigue, or pain in the legs with walking. Most people with PAD in the legs find that they can only walk so far, and then pain or cramps develop that make them stop. After short rest, the pain may subside, and then they can walk again. At more advanced stages of PAD, there may be pain even at rest. Sores on the legs may develop with only minor injuries, and then fail to heal completely. At even more advanced stages of PAD, areas of dark, dead tissue may appear on the toes or feet. At the most advanced stages, amputation may even be required. You may be at risk if you are 50 years old or older, particularly if you are a man, or if you have high blood pressure, or if you have diabetes, particularly if you smoke cigarettes, if you have high cholesterol, if you are overweight, if you don't exercise regularly, or if you have a family history of circulation problems. And here's what to look for. First, aching or pain in the legs with walking. Second, pain in the legs or feet at night or with rest. And finally, if you have non-healing sores or infections in the toes or feet. So what can you do now? Here are 5 preventive steps that you can take to avoid complications of PAD. First, and most important, stop smoking. Quitting smoking at any age will help improve your health. Second, eat a healthy low-fat diet. Third, maintain a healthy cholesterol level. If you don't know your cholesterol, have it checked. Fourth, monitor your blood pressure and have it treated if it is too high. And finally, make exercise a regular habit. If you think you may have PAD, discuss your problems with your physician. If a problem is suspected, you may be referred to a vascular specialist for a diagnosis or treatment. A vascular specialist is a surgeon who is trained in all aspects of diagnosing and treating PAD. Your vascular surgeon is also able to provide a range of treatments, including minimally invasive treatments like balloon angioplasty or stents, plaque-removing treatments, and open bypass surgery when this becomes necessary. Your vascular surgeon will also provide long-term follow-up care to help you maintain a healthy circulation system. Peripheral artery disease is a serious problem, but there are things that you can do yourself and many new technologies available to treat PAD and keep you walking. For more information, you may contact us at 830-1251. You may also find information and referrals at vascularweb.org, or you may call Harrison's referral line at 866-844-WELL. I'm Dr. Jeff Bernstein. Thank you for watching today. For all your healthcare needs, choose well.